So most of you are familiar with Mackay. So their dissector really is just the conical tip that screws onto the endoscope. So, you know, some people call it the bullet tip, some people call it a conical tip, some people call it a dissector tip. You can call it whatever you want. Most people are familiar with this. So this is just a plastic piece that comes in the set. The required endoscope to use is a 5mm endoscope that has a threaded tip on it. Big thing with this is that you don't want any moisture in this before you put it on, because if you have moisture and you put it in there, this heats up and it'll cause some condensation. You won't be able to see, and this is impossible to clean, speaking from experience. So if you have put this in your harvester, it gets a little blood on it or some, you know, interstitial fluid. You take it out and you say, I need to dissect more. Be sure to really clean this off and the threads and, you know, any part that's going to be covered by this. Otherwise, you're in trouble. So this is the dissector tip. I usually call it a conical tip. I don't know why. That's just kind of how I learned. So you can see this one's the longest of all of them. Now, if we compare it to Terumo, you know, it doesn't matter how long the tip is, because this one, you know, has a long shaft right behind it. But what I looked at was the length of the tip of the scope to the widest point of the scope, how far that was. The HemaPro has the longest distance from the tip of the scope to the widest part of the scope. It has the most acute angle, which makes it the sharpest of the three scopes as far as the dissector is concerned. Looking through the end of this this conical tip, there's no guide to the center point. After a couple uses, you definitely understand where the tip is. So that's the Mackay HemaPro. If we look then at the Terumo VirtuSav, obviously it looks quite a bit different. So this is a sheath that fits over a 5mm endoscope. Oddly, it's not that much wider. So comparing the two together, the Terumo tip of the dissector is actually only 0.5 millimeter wider. The HemaPro is 12.5 millimeters wide at its widest point, and the Terumo scope is 13 millimeters wide at its widest point. Now, there is a difference in how long it takes to get from the tip to the widest point of the scope. Like I said, HemaPro's is the longest, is actually 33 millimeters from the tip of the scope all the way to the widest point, whereas Terumo's is only 22 millimeters. So it's 11 millimeters less to go from the point to the widest point. So it's a little bit more blunt, and actually that can be helpful in some cases if you're popping windows out into the walls of your tunnel to get more branch length. That more blunt tip protects you from going too far. I think with the HemaPro or with the Mackay or getting a dissector, sometimes it would get away from me because it's so sharp. Now, obviously, when you have experience with it, you don't do that, but there is potential for it, especially for a new harvester. So that blunt part helps a little bit with the windows. It hurts you, though, when it comes to teasing a vein off of like the underside of skin. If you have a very skinny patient and you need to get that vein peeled away from the skin, that blunt tip, the fact that it's more blunt, does potentially create more trauma. So you have to kind of be more careful than teasing it away. Whereas with the HemaPro scope, you have a little bit more leeway because it's a more acute and longer gradual distance from the tip to the wider point. You can have a little bit less trauma with it, which is kind of nice. Finally, we have the Venapax by Safina, and it looks very similar in appearance to the Terumo scope. Now, if we look at the tip of the scope is the most blunt of all the scopes. So this is 19 millimeters from the tip of the scope to the widest point, whereas the Terumo scope was 22 millimeters, and the Mackay scope was 33 millimeters. So progressively, shorter run from the tip of the scope to the widest point as we went down our list. So most blunt, it's the least acute angle. This very unofficially measured out to be 41 degrees. Terumo ended up being 33 degrees, and the HemaPro ended up being 30 degrees. You'll feel that as you dissect. And again, that helps you if you're popping little windows to get some extra branch length and not creating too many false tunnels. But it does also hurt you when it comes to really delicate tissue or teasing, the vein from the backside of skin. A lot of harvesters have problems with that blunt angle because, you know, if there's a crossing vessel or something in your tunnel and you get the tip of your scope right in between the vein and that crossing vessel, that's great because you're peeling it off. But then as you slide it forward, that's pushing that, you know, the blunt angle of the scope is stretching as you go past, you know, your view, your field of view. And so if you don't leave a little bit of space and kind of work around that, you can, you know, if you put the tip of the scope right on a fragile tissue, which could be the vein, could be a branch, it could be some crossing vessel, and you push forward as that, you know, conical tip pushes that tissue up and away, it could tear it or rip, and that's where a lot of bleeding comes from.